saved my life. It really did. It saved my life. Because now I can do all the things I want to do.
The beauty of the X10 is it doesn't just passively move your knee where you're not thinking about it, but you're in that machine, you're actively engaging your muscles, you're firing your neuromuscular system, it improves your vascularity, decreases the risk of a blood clot, and people are getting their motion back faster, they're having less pain, it's easier on the family members that are there helping take care of them.
I'm not selling the X10, but I tell you, I could not have done this without that machine. Could not.
In getting that knee motion faster, which we can do with the X10, getting the swelling out faster, which we can do with the X10, on top of the more frequent therapy, what we're seeing is significantly shortening what that painful window is.
One of the interesting things that I found with the X10 is my patients were coming in and requiring less pain meds after, a couple uses of the machine.
Being in finance and marketing my whole life, normally when something sounds too good to be true, when you actually get to the real facts, many times it's not true, but in this case, it exceeded my expectations.
Whatever we're able to do on the front end is only going to complement what they have to do after surgery. And so the ability to use the X10 is so important with total knee arthroplasty because it will help stabilize the knee. It will give the patient confidence to be able to go up and down stairs, to take long walks, to go on unlevel terrain.
To be honest with you now, that have been with me here since my surgery, it was worth every dime.
So Kevin says, I want to go back to work. He goes, what? He says, I'm shooting for a date, like May. I want to go back.
He's looking at me like I had two heads.
Yeah.
And then when he saw my leg that day, he said he couldn't believe the condition of the muscles in my leg. He couldn't believe it was the same leg when he saw it.
Yeah, he was,
He said, oh, what's the name of this machine?
I can't say enough about the X10 people and how they helped me with my coaching, to the machine they brought to my home, and the quick healing that this machine has allowed me to do. Anybody that has surgery on their knees, you owe it to yourself to get a machine like this to help you.
We had heard horrible stories from friends who had had knee surgeries, like, oh God, if you're going to need both of them, get them both done now because you'll never go back and have the second knee done because it's horrible. My in-home therapist was amazed when he showed up, and I was walking as well as I was. And I tell them it's because I had an X10 machine.
It's only been 7 weeks since my left knee replacement, and I'm doing things at 7 weeks that I couldn't do at 4 months. I need to be functional because I'm a type 2 diabetic, and so far I've lost 25 pounds because of my knee replacement. I really believe the X10 had a lot to do with that. Because I can exercise more, I no longer need insulin, and my primary care doctor is just amazed at my progress.
I think eventually this will be standard of care. I don't think there's any question in my mind that this was a standard of care for me.
They've been delighted with that machine. They've been, their range of motion has been substantially improved. Their quicker rehab, even as an outpatient after the X10 machine has been used, and the patients are very satisfied and very happy with the outcome. If they are happy, I am happy.